Hello, Dr. Tom. How are you today?
Excellent. Good morning, Matt. How are you?
I'm doing well, thanks. It's great to see you. You look good in Causenta purple, and it's a good look for you. And I know that everybody on Lucy's team will probably be delighted to see you in purple because it all blends very well together. If anybody would like details about Causenta and the wonderful things they're doing, the goal there at Causenta is to kill cancer once and for all with minimal side effects. The website is causenta.com, causenta.com, and we'll put links in the description below. Before we get started with today's topic, which is bladder cancer. We've been working on discussing each of these very serious cancers with Dr. Tom, and this week we were diving into bladder cancer. We've done breast cancer, we've done colon cancer, we've done brain cancer, and these are very serious and heavy topics. So before we get serious and heavy, I wonder, Dr. Tom, if there's anything new and fun and interesting and inspiring and exciting happening at Causenta Wellness. I assume that there is. There almost always is.
There always is. So what's really exciting, started yesterday, so very recent, and it's continuing till today. We have a manufacturer that brought in a new light therapy-based technology. So just think of like a light on the outside of your body hitting your skin. And we're looking at how that light reduces markers of inflammation and even induces damage to cancer cells. And what's kind of cool is it's not invasive. It'd be like, imagine you're laying on a beach getting a suntan and somehow those rays of light are killing cancer in your body. So we're collecting some blood samples. While I'm here right now, my team is collecting blood samples before, and then they're going to have some lights, exposed to people, and they'll draw some blood samples later, and then see, what does it do? This is stuff that's so simple, and it's so, I guess, non-threatening to someone's health. It's amazing that no one's thought of this stuff or been looking at this stuff before at this level. So imagine super simple strategies to help people get rid of pain in their joints. And we don't know this yet, but we think it may help to actually reduce the threat of cancer in their body. And if it works, it'd be phenomenal. Then it'll allow us to get some funding to do more, like a real clinical trial, not just some observation for case study support, but something that could be more applicable to other people. And today's topic, what's interesting is there's some unique things that have come out recently that ties into the topic as well. And it'll connect some of the dots that we've been sort of talking about over time about at Causenta. One of the things that's really cool is that the ways we're integrating so many different tools that traditionally were never thought about for treating cancer. So you can't make a claim that, hey, it fights cancer, it does something. But on the other hand, people are feeling better and they're showing signs that cancer levels are lower in their body. So it's exciting, just to see people getting healthier and improving. We have a recent brain scan. One of our patients had a glioblastoma. That was a topic we had talked about recently. Scan came back, shows no evidence of disease. This is now going on 6 months or maybe a little bit longer since we saw her physically at the center. We continue to monitor people. And then we have another individual with a colon cancer that's showing no signs of cancer, a little bit almost a year later. So these are very exciting things that hopefully we'll be able to use and do for other people.
Oh, that's exciting. For those of you who weren't with us on the episode where we talked about glioblastoma, that's brain cancer, and it's the brain cancer that was made famous or infamous by Senator John McCain from Arizona, and the diagnosis or the prognosis that was made famous and that I heard about and you mentioned was they pretty much said there was nothing they could do for him, right?
Yeah. It's just, I would say that it's, imagine if you asked me to solve a problem and before I even try to solve it, I say there is no answer. You would be like frustrated, like, Tom, how come you didn't put effort into this, And we all know that cancer is a terrible disease. It's an extremely complex challenge. But we also know if you do nothing, you don't get a result. So somewhere between those two extremes, we got to have a balance and say, you know what, let's at least try to see what we can do. And if we're monitoring things objectively, then patients can find out for themselves if it's working or not. And then they can continue to go in that direction if something is working. And if it's not working, then hopefully whoever is helping that patient will change what is being done. So that way the patient eventually gets results.
Well, we're talking with Dr. Thomas Incledon for the Ask Dr. Tom show. And I've been watching what happens with these videos, and there have been thousands of people that have watched these videos that we've broadcasted live on Facebook. And one thing they have in common is all the people that watch or listen or watch parts or whatever are very busy people. And what you find is maybe you come across one of these shows or these videos or these segments, and then maybe you lose touch and you don't really ever keep up with Dr. Tom again. So if you're interested in finding out more about alternative medicine and the breakthrough treatments and pretty much mindset they have over at Causenta, led by Dr. Tom, the best thing I can suggest for you to do is to take out your mobile phone and text the word health to 72000. That's 72000 if you're in the United States. Just text the word health to 72,000. If you're outside the U.S. and you're perhaps in Canada or the U.K., you can still text the word health, but do it to this number, +1 315 930 0300. And we're going to put that below the show in the video notes while you're watching it. So without further ado, let's dive into the topic today, which is bladder cancer. Obviously, I know what a bladder is, but I don't know that much about bladder cancer, and I would imagine a lot of people, unless or until they're diagnosed, also don't. So, Dr. Tom, what's bladder cancer, and where does it occur?
Okay. So bladder cancer is when there's malignant cells or cancer cells that originate in the tissues of the bladder. So, most people kind of have this idea of, when I have to go to the bathroom, I have to urinate. I know somewhere urine is stored in my urinary bladder. But there's one of the things that's occurred to me is as I've listened to questions from patients from the past, sometimes in a podcast, we're not maybe given a good visual, like of where, let's say, the cancer is. So imagine in this case for bladder cancer, you have this sort of balloon or hollow type of organ inside the body, so in the lower abdomen, and that balloon, if you will, stores the urine, and then there are tubes called tubules that go from there to the kidneys. One kidney will be on either side of the spine or the backbone, so like a left and a right kidney, if you will, and then those kidneys will basically have urine passes from the kidneys, and it goes through these, so there's material going into the kidneys. Then from the kidneys you have liquid or urine leaving, going through another tube called a ureter that eventually will make its way and connect to the urinary bladder. And the bladder will hold the urine until you basically let it out. So just like a balloon, when you open up the end of the balloon and air would come out, the bladder will empty. So it has the ability to expand and contract, and that's important because what should happen is as the urinary bladder swells up, there should be signals going to your brain that say, hey, I have this urge to urinate, and then you should be able to go to the bathroom and basically void or empty everything out. Now, sometimes people have problems with that. So, for example, sometimes men have trouble. The urine stream or flow is not the way it used to be. So it's not like a direct stream. The urine may spread out or spatter out. So then a doctor might look at, if they have prostatitis or do some other types of diagnostic workups to see what's going on. In the case of bladder cancer, there's a lot of components to cancer where things could change, and people may not know this is going on until it's fairly progressed. And so like so many of the other cancers that we've discussed in the past, it's not like you could feel cancer growing in your body and you go, hey, I got some cancer cells, I better take action. So, first, let's say take home summary point would be everyone needs regular checkups because then you can catch a problem much earlier as opposed to waiting till you feel the problem. And then by then it's probably pretty advanced. And then the treatments for this particular cancer, they could be pretty harsh on the body. So, in order to save yourself time, money, damage, pain, the strategy is get tested or get checkups regularly so we could find something much sooner.
We're talking about bladder cancer. Unfortunately, these cancers are killers. And one of the common themes that we've learned from talking with and asking Dr. Thomas is early detection obviously is key. And you hear doctors and you hear medical professionals say this stuff all the time, whether it's the people on TV or the people that you see in the office. And unfortunately, for a lot of people, they don't go to the doctor often enough to test these little things and find out what could be going wrong. So, Dr. Tom, with regard to bladder cancer, what are the signs and symptoms of bladder cancer that you might notice if you're not going and getting regular checkups? What could be going wrong?
Sure. So the signs and symptoms of bladder cancer would include things like blood in the urine, maybe some pain. It might be like abdominal pelvic pain, so you would say lower down in the abdomen. Frequent urination would be another one. Maybe pain during urination, and sometimes lower back pain. So those would be the common symptoms associated with bladder cancer.
Is there any, when you describe some of those symptoms, and even when you earlier when you were talking about what bladder cancer is, you mentioned men and their prostate. Is there, it makes me imagine that maybe bladder cancer might be a little bit more common or a lot more common among men. Is there any sort of differentiation between the sexes when it comes to risk or actual diagnosis?
So in preparations for today, it didn't really show up that bladder cancer was more common in men than women. But I will say this, right now, all of the bladder cancer cases we have are all female. I can't answer that at this point if that means across the board for everyone else. I think one of the challenges is that when we get into talking about the different types of bladder cancer is when we look at imaging scans and sometimes diagnostic reports or pathology reports, when patients coming in, they don't always have it listed as bladder cancer. They may be listed as urothelial carcinoma or some other type of cancer. So the people then may not even know that what they have is a bladder cancer versus some other type. So it might be a little bit more confusing that way.
We're talking with Dr. Tom. This is Ask Dr. Tom. You can download and subscribe to the actual podcast of the show at askdrtom.com. And Dr. Tom is Thomas Incledon, the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona, where you can go to causenta.com right now or after this broadcast or anytime, send a loved one there and find out more about the team, but also sign up for a free consultation, whether you've been diagnosed with cancer or you just want to get healthier. Go to Causenta.com. The topic today is bladder cancer. And as we've learned from other behaviors, there's things like eating bacon, for example, have come up with regard to other conversations about cancers that we've discussed previously. Are there risky behaviors or things that people do that increase their risk of bladder cancer?
There's a pretty long list of risks for bladder cancer. I got a list in front of me, and I'm just going to read off a couple of items. So, as with a lot of cancers, one of the first ones is tobacco use, particularly smoking cigarettes. And other types of risks would be things like family history of bladder cancer. There's also now knowledge that certain genes are linked to bladder cancer, meaning that some people may be born with a mutation in their own genetics that was passed on by either their mother or their father or both parents, and that trait, it could increase the risk for them to develop bladder cancer later on. There's also knowledge now that exposure to certain chemicals from the environments from the environment can increase risk for bladder cancer. So as an example, certain paints, dyes, metals, or petroleum products in the workplace. So there's still a lot of people that work with their hands for a living, and they're exposed to a lot of these common substances that for many years no one really gave much attention to. But now that we have data on more people and we're starting to see there's certain trends in the population that people that are exposed to certain chemicals in the environment tend to develop certain types of cancers. There's also now some findings that people that have been treated in the past with radiation to the pelvis or certain other anti-cancer drugs such as cyclophosphamide or ifosfamide, so meaning perhaps they had one type of cancer in the past, as they went through treatments involving those two chemotherapy drugs or radiation therapy, that set the stage for them to get DNA damage that has now led to the development of bladder cancer years later. Some other things that have been discovered is there's a Chinese herb, and there's possibly more herbs that may be linked to bladder cancer. There's concerns about drinking water from a well that has high arsenic levels. I can share with you that we've tested lots of people that drink water from a well, and over time, the filtration mechanisms for the wells may break down. And so the water slowly becomes more contaminated over time, so that people don't taste the difference. If you showed up as a guest to their property, you would drink the water and go, wow, this tastes terrible. But it's changed so slowly for them, they've gotten used to that taste, so they don't know that there's a problem. So that means, from the perspective of prevention, not only do we want to routinely monitor ourselves, get regular checkups by a physician, but we also may want to think about regular checkups for the water supplies, or for the water and or for eating produce grown from, let's say, farmer's land nearby. It's important to know what's going on with the water supply and the food that you're putting in your body, or you could be inadvertently introducing other vectors that you're not aware of. And then some other things include water treatment with chlorine, history of bladder infections, and having catheters in for a long time. Sometimes after people have surgeries or put on certain drugs, they may not have the ability to urinate on their own because there may be some loss of smooth muscle tone. So they may have to have a catheter inserted in them. And one, the catheters can easily increase the risk for infection. And then two, they can be irritating to the lining of those tissues. So the common denominator for both of those things is that there's increased inflammation, which would increase DNA damage in the bladder, which would set the stage long-term for bladder cancer. So it's quite a bit of risk there. Now, a lot of this comes down to if you're limiting exposure to chemicals in the environment, and if you're drinking water that is, let's say, not contaminated, you can reduce a lot of these risks. And if you're getting regular workups, you'll find out right away if you have, a urinary tract infection or something else going on. It could be treated quickly, and then you don't have to suffer longer and set the stage long term for some type of bladder cancer or something else developing.
It sounds like really taking a look at your drinking water is something smart to do. We have well water in our home, and we get the well water tested to make sure that whether we taste it or not, we know what the levels of the water are. But even it's in your list, this chlorine-treated water, which is pretty much city water, has a little bit of treatment in it. It sounds like everybody should be careful. So we're talking about bladder cancer. This is Ask Dr. Tom. And I'm looking ahead at the notes. I'm cheating a little bit here, and I see that that it's common for bladder cancer to reoccur. I'm just wondering, what is it about bladder cancer that makes it common for bladder cancer to reoccur?
So some of the cell lines, or the cancer cell lines, within bladder cancer, they're very invasive. So think of it as they may spread deep into the tissues, they may get into the blood supply, and they may be resistant to different treatment interventions, one of the things I'd like to insert here is that we have lots of people coming to our center that when they walk through the door, they have a philosophy that, I don't want to do chemotherapy because it's a poison and it will kill me. And there's many of the chemotherapeutic drugs, they're pretty powerful. But one of the things that I've learned is that sometimes people had something done the wrong way. And because they only have a limited exposure or limited experience, or they only seen a limited application, they're now saying everything is wrong. And an example I'd like to use a lot of times is, imagine if you and I go to the gym and you watch me squat and I have really poor mechanics when I'm doing like a back squat, and now I hurt my back. And after I hurt my back, I tell you, exercise is bad. Exercise will harm you. And you would there to witness what happened. You would say, you know what, Tom, you had really poor mechanics, and it's not that exercise is bad, is that you put yourself in a precarious mechanical position and you got hurt. So what's happening a lot of times right now is you have many companies that make money off of fear of people. So they're pitching, this will kill you, this will kill you. So don't buy that, instead buy my stuff. That's their pitch. And then you have, on the other hand, you have the opposite pitch is, look at all the funding by drug companies for medical school, and look at all the regulations by the FDA are clearly biased. So you got a lot of extremes, and you have the average person is stuck in the middle trying to make sense. And unfortunately, their decision making is based off of who has the best marketing, and what do they read. So there's a lot of visual bias in the strategies that people employ. So I insert that because if a patient's commitment is to be cancer-free or to beat their cancer, they should consider exploring all treatment options, because it's simply the best strategy they can do to make sure they get the right treatment. There is no single treatment that works for everyone. There is no single treatment that is perfectly safe, that'll never create a problem for anyone. Every treatment has some pros and cons associated with it, and you do the best you can to pick a treatment or a series of treatments that minimize any risks or concerns. Getting back to your question about why is it common for bladder cancer to reoccur, is a lot of these cells can become resistant to any type of treatment. It doesn't matter if it's conventional or standard of care stuff like chemotherapy, radiation, or surgery, because there could be cells in the blood that a surgeon cannot remove, or there could be cells in other tissues that a surgeon cannot remove, or it could be the cells develop what they call multi-drug resistance proteins, which means the cancer cells don't respond to chemotherapy. But they also can become resistant to vitamin C and to other natural options as well. So it's not so simple as saying, well, I won't do chemo, but I'm going to do this other thing over here because it's more natural. That doesn't translate out to a better outcome, instantly. And where we're able to excel and really help people is our oncologists and our naturopathic doctors and all the other doctors we have at our clinic. They actually talk about each case together, and they're able to navigate the complexity of these situations and say, you know what? This guy is not going to need this med or this supplement or this exercise regimen. Instead, this person's going to need something different. And that's where, hopefully if things line up the way we want them to, each patient gets the right combination of therapies to really help them beat this. And, and ideally minimize the likelihood of the cancer coming back.
You, in the past, Dr. Tom, have mentioned many times that if somebody gets breast cancer, for example, there isn't a one-size-fits breast cancer. It's not necessarily about where the cancer is. It's more specifically Jane's breast cancer. Are there different types of bladder cancer? And then if there are, do you treat those and customize treatment based on the different types there are? Or is it kind of just a one-size-fits-all thing?
Yeah, so it's definitely not a one-size-fits-all. I wish it was. Sometimes it would make things a lot easier. If everybody say, hey, take one pill, you're all better, But it's nothing like that. If we were to, keep in mind that most of cancer, the diagnosis is largely based on geography, meaning where is the cancer located in the human body. the challenge with that strategy is that we've learned so much through current science that we know no matter where the cancer is located, that might be the geography, hey, it's a bladder cancer, but it may have genetic aspects that mimic that of a lung cancer or a brain cancer. And the way that drugs are approved, they're approved for claims for a given cancer, which is based on the geography. So there's some challenges with helping people get the right treatment for the right cancer. But generally speaking, you would divide bladder cancers into three categories, if you will. So one would be transitional cancer or transitional cell carcinoma. These would be cancer cells that start in the innermost layers of the bladder. So think of it as a smooth muscle that makes up the outside of the bladder, and there's layers in that muscular tissue, and there could be cells throughout those layers. Those particular cancer cells are in the area of the body that when the bladder is expands or shrinks, the cells can stretch a little bit. So they can, almost like your muscle cells can get longer or shorter as you contract a muscle. You could think of those particular cells in the bladder, they could also move, which are expand in length and shape. And the significance of that is that those types of cells is where you see a lot of the transitional types of cancers. So that's a more common one. So that transitional will be one category. You then have a squamous cell carcinoma, which is a second category. And a squamous cell just refers to the shape and size of the cells that become cancerous. So generally speaking, squamous cells are thin, flat cells, and they typically are formed in the bladder after a long-term infection. Then you have also an adenocarcinoma. This is a cancer that begins in the glandular cells. So generally speaking, you think of a gland as a tissue that produces a substance that gets secreted into the blood. Typically, those substances are hormones. And so an adenocarcinoma bladder cancer is a little bit more rare. And one of the ways you can know, there's different pathology tests to see the types of these cancers. And then there's a last one, or a fourth category, if you will, called the superficial bladder cancer. And this is when the cancer spread through the lining of the bladder as opposed to inside of the muscles. Now, when we talked earlier, when I first started talking about the transitional cell carcinoma located in sort of in the muscle, or the innermost layers of the bladder, there's a couple of categories within that. So you have a low-grade transitional cell carcinoma, and you have a high-grade transitional cell carcinoma. The low-grade doesn't usually spread, and the high-grade usually does spread. So as you can imagine, from hearing that, it's not just so simple like bladder cancer. We all got the same bladder cancer. In other words, if people have that same diagnosis, even at a very superficial level, you have different categories. But then beyond those categories, you could do all kinds of genetic tests that further delineate the differences between all those cancers. Most of the time, the way that information is interpreted is if you have a certain gene in that given cancer, there may be a drug that has already been discovered that may be a good tool to treat the genetic attributes of that cancer. One of the challenges with that approach, though, is that some of those cancer cells mutate and change, so that single therapy may work at the beginning, but it does not work forever. So at some point, those cancer cells develop resistance mechanisms, or they change, and that initial drug that was used no longer works. And so that is why the recurrence rate, or it's a contributing factor, why people may get a bladder cancer again.
This is Ask Dr. Tom with Dr. Thomas Incledon. Instead of asking Dr. Google or searching WebMD and getting freaked out, best to ask a real doctor and a scientist, and that's why we have Dr. Thomas Incledon here as the host of the show, Ask Dr. Tom. Today we're talking about bladder cancer, and Dr. Tom, I'm reading that bladder cancer, if it recurs, patients may undergo a cystectomy. Did I say that right? What is that?
Yeah, so a cystectomy is when you remove part of or all of the bladder, and so so typically it's done when cancers start to spread and it's becoming invasive, meaning it's spreading, outside the bladder, or it's permeated the bladders to such an extent that the oncology team involved says, hey, look, the best way to help this particular patient is remove this tissue that has so much cancer in it. And then the idea is, it's an attempt to do something, you might say fairly extreme, in order to help this person survive, because otherwise they may, it's the more that cancer spreads, the harder it is to treat it, and the less likely this person is going to make it.
Sounds.
I'm sorry, I was going to say one other thing. You earlier, when you asked that previous question, you mentioned about the treatments customized, and I didn't get a chance to talk about some things, and I thought maybe this might be a good opportunity to insert some of that. When people talk about customizing treatment regimens, generally speaking, people think of like a drug or a supplement, but they think of taking something, and that's the treatment. Many times what I see is people totally ignore other, let's say, lower hanging fruit treatment options. So one example in particular is the lifestyle, or maybe even the support network. I can't tell you how many times we see families come in, and so you imagine you have a woman with a woman with bladder cancer, and she's got her husband saying, I want you to do this, and she's got maybe her parents saying, I want you to do the opposite. So this poor patient is surrounded by people that love her, but they're pulling her in opposite directions. And so one of the things I would like to share with everyone that listens to this is that, the focus is everyone's got to be on, the team to support the person that has the cancer, and you support them by helping them to understand things, making sure everyone's present at all the meetings with the doctors so they're hearing the same message. Because if we have two different stories, we may have two different answers, and then that's going to be confusing to the patient. And then simultaneously, making sure that they're comfortable with the decision. There is no right or wrong decision, because there's no crystal ball to see what happens, once you make that decision. So each individual has to make the best decision they can, but hopefully they have the medical support from a team that says, hey, we're going to monitor you. And if that decision is not producing the result we expect, we're going to change direction here, because our focus is you live. And so we're not committed to a specific drug or treatment regimen. We're committed to you as a patient. So the main point is that a major factor that impacts outcomes is support by loved ones or family and things like that. And a lot of times that's just, it's kind of ignored, as a big deal. And I think it arguably could be emphasized as one of the major components. And so along that, I would put like behavioral change and mindset. We have patients that'll come in and make all these incredible improvements, and they go right back home to eating, ice cream and pizza every night, or hamburgers from fast food restaurants. Excuse me. And the problem with that is they developed certain nutrient issues that led to inflammation and perhaps DNA damage over time. Now they got their health back under control, but then to go back to that same pattern, it's almost like setting a stage where you're going to have a problem again in the future. And given how overwhelming cancer is, and given how expensive it is to treat, and all the other challenges that people encounter, I would encourage everyone to really consider the decisions they make, going forward, because it could literally make or break their pocketbook, their wallet, whatever you want to say. The other aspect of things, I see lots of people doing things like yoga, and I have nothing against yoga as an exercise modality or meditative tool, or depending on your perspective. But when you're in the hands of a competent physical therapist or personal trainer or performance coach or someone that assesses fitness, they don't just say everybody do yoga. Instead, what they'll say is, let's see what you need attention with. Maybe you need some help that goes beyond yoga, or maybe you need some help that requires a lot more neuromuscular re-education, or you have arthritis that's so bad in your knees you can't walk. Well, how are you going to improve your fitness if you can't move? So sometimes we have to help people rebalance their bodies through better neuromuscular control. Sometimes we have to strengthen the muscles around their joints so they can move better, and in the process of moving better, exercise more to improve their fitness, to benefit their immune system so they can do a better job of fighting cancer. But those are not, 1, 2, 3 approaches in a week. That takes sometimes weeks to months to really get all the benefits there. And then I get a lot of questions about nutrition. What diet should I follow if I have cancer? And the thing I'd like to interject is we've now measured collectively well over 40,000 people just at our center. If we look at the experiences of other doctors that are joining us and what they measured at other centers, you could argue that collectively all these different doctors maybe measured over 100,000 people. And the findings are that when it comes to nutrition, no two people respond exactly the same way. And there are some unique things where some people do dramatically better with certain foods than other people. And they try to say food allergies. The problem is when we measure their immune reactions, there is no immune reaction. So it's not an allergy. There's something else going on outside the immune system that's affecting them. So we try to really dial in nutrition for each person. But if I had to boil it down, rainbow diet, eat variety, that's a simple message that I think will consistently hold up over time. And in other ways, minimize exposure. There's a lot of controversy right now over wheat products and lectins and other things. And so at least by sticking with fruits and vegetables, you minimize a lot of that exposure. So whether it pans out later on to be true or not true, you're still somewhat safe because you're still getting all the micronutrients you need for health and survival. And of course, then there's all kinds of other options in the oncology world. There's so many new medications and drug options for treatment that there's always options to help someone. It's just really as the medical team you're involved in, are they willing to put that time in to figure out what to do to help you?
We're talking with Dr. Tom. This is Ask Dr. Tom, and today's topic is bladder cancer. Dr. Tom, after multiple recurrences, patients may undergo this cystectomy, which you explained is when you take out a part of the bladder. Is that an effective treatment?
So, that's such a tough question to answer, I think. So first, I'm not a surgeon, right? So if you asked a surgeon that question, they may give you a totally different answer. So I'm not talking about it from a practical experience since I don't do surgery. But I could tell you that my overall impression is that a lot of times I see a lot of surgeries that are done that are unnecessary. And so I'm not saying a cystectomy is not unnecessary, but I would say it's definitely one of those things where you want to get different doctors from different institutions to weigh in on it and give their impression. Then let's assume it is necessary. For the example here, there's a lot of issues that develop afterwards. When you remove the bladder, there's a lot of rehab and therapy and other things that have to be done to help someone to urinate, close to normal again. And many times there's sexual dysfunction issues that happen afterwards, or there's other secondary problems that develop after those surgeries. And that could totally change. If you're let's say a younger person and this happens, that's the rest of your life that it could have a significant impact on. So the idea is that on the one hand, you don't want to wait too long to make a decision and increase the risk of you dying from the cancer. But on the other hand, you don't want to run right in to get a surgery because the consequences could be life-changing.
What are some of the side effects if somebody should consider if a doctor or a surgeon is recommending that part of their bladder be taken out because of bladder cancer? I mean, what are some of the things that could go wrong?
Yeah, so some of the side effects that are associated with that, well, There's general side effects that you would say are possible with any surgical procedure. So, you're going to have anesthesia, so you may have a reaction to anesthesia. Since you are having a surgery, there's always a low risk for an infection. Anytime you breach the skin barrier, there's a possibility of an infection. After surgery, there's a possibility of bleeding from the surgery. There's a possibility of developing blood clots throughout the body. There's a possibility of damage to nearby organs. You have the possibility of either an infection at the organ site or an infection throughout the body. Sometimes it just gets in the blood and travels. You have, and then I guess maybe a simple one that I should have probably led off with is pain after the surgery. Now, one of the things I didn't touch upon, though, is that there are a lot of newer robotic surgical methods. There are certain, I was reading at some data from a medical center in Japan that is doing the vast majority of their surgeries using robots. And people might say, man, I don't want a robot touching me, because we're used to human beings, right? We're not used to robots. But the outcomes are extremely impressive, and it's hard to ignore. A robot doesn't get tired. They don't need to take a break. They don't get fatigue, like, oh, I did 10 surgeries, I'm getting tired. And, their accuracy is far more accurate than a human being, and for some of these surgical procedures. So I would imagine in the future, more and more people are going to be requesting that as opposed to being afraid of that. So it's something to consider. It might not be something everyone jumps right into, but it's something to consider. The significance of that, by the way, is that the robot will most likely not damage as much healthy tissue during the process, the surgical process, where a very skilled surgeon may have to, go around. Surgeons are trained never cut through cancer, but go around it. And the idea behind that is you minimize the likelihood of you spreading the cancer after surgery. So that means they're going to cut into healthy tissue. And so if you have a robot that can cut closer to the cancer line or cancer margin line, then there's less damage to the healthy tissue after the procedure.
We're talking about bladder cancer, and it just went into robotics, which I don't know if it was you or somebody told me, and I think it was you, that the best surgeons in the future are pretty much all going to be robots. Was that something that you said?
Yep. Yeah. I mean, I have a couple of colleagues that are very skilled. I have actually more, I would say a dozen or more that when I was competing, we'd have, my joints would get inflamed or damaged. And these guys would inject something into my knee or my hip or my ankle or my shoulder. And I can remember one time telling one of the docs, okay, let me know when you're ready. He goes, I'm already done. I never felt anything. No anesthetic, no local, just he's in and out of the joint with a needle. They're incredibly skilled. And so, they've done it though thousands of times. So this for them is, the equivalent of us throwing darts at a dartboard and hitting the bullseye without trying. That's how easy it is for them. And as skilled as they are, there's actually opportunities in the future where with some of the robotic technologies, they could have sensors on the end of the, let's say it's a scalpel or some other robotic, tool, and those sensors will be able to delineate between diseased tissue and healthy tissue. So that's how they can cut closer to the diseased tissue, and so it shows a lot of promise, for the future.
That's pretty amazing. This is Ask Dr. Tom with Dr. Thomas Incledon, and we're talking about bladder cancer. This is a question from somebody, a fan or a listener or a patient. The question is, I have blood in my urine. What does that mean? Or does that mean I have bladder cancer?
Okay, so just because there's blood in the urine, it does not mean there's bladder cancer. The first thing that you would think of is, okay, if it's first, is it a man or a woman, right? So, like if it's a woman, you'd have to make sure she's not menstruating, because certainly there'll be blood in the urine during certain times of the month. Assuming it's not a time for her to menstruate, then you're thinking that maybe there's a urinary tract infection or a kidney infection. Those are the more common things that you would think of. And you can get a urinalysis and a urine culture Those tests are very easy to be done. They can be done by pretty much any doctor or any licensed physician, I should say. And some things to keep in mind is that while you could do that test any type of day, generally speaking, you'd kind of want to do that in the morning because you want the urine to have been trapped in the body for a while, so you're more likely to see what's there. And then there may be some sort of moist towelette that you may wipe yourself. Like you may wipe the opening of, for a man or woman, they would wipe themselves before they urinate into a cup or some other device to collect the urine. So then that way there's no contamination of the specimen that's being produced. And then the doctors would, order the necessary workup and see, basically they're gonna see what's in the urine. And they'll tell you then afterwards if there's an infection or something else. If they do a physical exam and they see something that doesn't look correct, then there's like some changes in the tissue of the body, then they may be able to get a biopsy specimen or get some sample, a scraping of some kind, and then send it out to a pathology lab. And the pathology lab could then say, hey, we found some unusual cells, and these cells are consistent with squamous cell carcinoma or some other type of cancer, let's say, of the bladder or maybe the urinary tract.
This is Ask Dr. Tom with Dr. Thomas Incledon, and Dr. Tom is the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. We're talking about bladder cancer, and Dr. Tom, there's a study published earlier this year that found that bladder cancer cells have olfactory receptors, meaning they smell or they can smell. Is there any truth to that?
Sure. Yeah, it's really interesting because so when we think olfactory, we think nose, we think smell. The thing, though, that I would encourage people to consider is that, at the end of the day, it's chemicals, and those chemicals are being converted into signals that get transmitted to our nervous system, and our nervous system interprets that data. So a lot of it is kind of similar to like a computer network processing information, moving back and forth. So if we think of olfactory receptors as just input tools, then any chemicals that could attach to those receptors could provide input that could lead to some sort of change in the body. And so I wouldn't look at it as, hey, cancer cells can smell. I would look at it as that now we have the ability to use odors to treat cancer, whereas before, I believe nature has already figured out a lot of things, and we're just trying to catch up to what nature has figured out. So those cancer cells that were in this particular paper, the bladder cancer cells, chances are they always had olfactory receptors, but no one took the time to study that or find it. So even though nature already knew this answer, we're just learning about it more recently. What's interesting is that there are lots of claims of people using aromatherapy or some type of frankincense oil or some type of aromas, depending on how you want to look at it, that claim they got results to treat their cancer. But when I would try to discuss that with people and say, you know what, show me a PET scan or a CT scan, or show me some CEA or alpha-fetoprotein or cancer antigens in your blood that changed over time, meaning they were high and now they're lower. I've never found anyone producing that kind of data. So typically what happens is people say, hey, I had cancer and I did this treatment and now I'm cancer-free. And you'd say, well, how do you know? If you didn't measure anything, how do you know you're cancer-free? And then they make the classic mistake of saying, well, I feel so much better. And we already know you can't feel the cancer growing, because if you did, there'd be no reason for testing. I'd just say, hey, Matt, how many cancer cells do you have right now? And you'd be able to tell me, and we'd be able to kill it off. You'd say, oh, yeah, they're all gone. There'd be no reason for testing. And so the mistake that many people make is, even though they acknowledge they couldn't feel cancer growing, later on, they go by how they feel to determine if the program they're doing or the treatment they're doing is working. And that's a big gap there. There's a lot of potential error. And so getting back to the study, what I see as a lot of potential is that it shows now there's new doorways to attack cancer and to beat cancer. Now, the one thing I will say though is this was not a study on people, right? So there's a lot more research that would still have to be done. But I would also argue that there doesn't appear any harm. So imagine if you come in and I got this, I should have wrote down the oil they used. I'm drawing a blank on it. Let's see if I have that in my notes. I don't have it. Oh, it was sandalwood oil. That was the oil they used. So imagine you come in, I got sandalwood oil all over the room. It either is going to help you or not. It's not killing you, right? So there's no real, I'm not even, for practical reasons, I'm not touching you, right? We're not even treating you. But it's an element that I have theorized for a long time that I believe there are lots of triggers in the environment that could help skew how we respond to treatment. One is the color of light. So if I walk into a room and I feel apprehensive about what's going to happen here, right? Then how well will I respond to that therapy if I'm afraid? Probably not as well as if I felt really gung-ho and let's do it. If there's a noise in the room that makes me feel scared or nervous or anxiety, how likely am I going to do well with this therapy? There's also things like pollutants in the air. So like we take all these factors into account in our center. We have filters that we don't do any surgeries in the building, but we have the air of the building filtered to a level that the microorganism count is so low, you could do surgery in any room in the building. And the rationale behind that is, I don't want people coming in and getting exposed to pollutants that may be a threat to their health. So if I'm in that building all day long, I don't want to be breathing in that junk myself, and I don't want my staff to be breathing in that junk. So we have like a lot of things we do that you might say, hey, that's unnecessary, right? It's too much, like too pure or whatever. But I would argue then we don't have to think about it, right? It's now that problem's resolved and we can focus on other areas because we know we have that particular area under control.
It's Ask Dr. Tom with Dr. Thomas Incledon, and if you are interested or somebody in your family might be interested in alternative health treatments, remedies, and just concepts in general, the best thing you can do is take out your mobile phone, whether it's an Android or a iPhone, doesn't matter, text the word health to 72000. If you're in the US and Canada, just text the word health to 72000. If you're outside the US and Canada, you can still text the word health, but text it to +315 930 0300. We post all the episodes of Ask Dr. Tom at askdrtom.com. Spell out the word doctor, and you can subscribe and listen on whatever platform you prefer, iTunes, Stitcher, SoundCloud, you name it. askdrtom.com. Today's topic has been bladder cancer. Before we say goodbye, is there anything else that you'd like to add about bladder cancer treatment, Causenta, anything?
One thing I'll share is that we actually have a particular case right now that it's a difficult case of bladder cancer. This is a lovely woman in her 70s, and the cancer spread throughout her body. And we have some ideas to help her. I would ask that anyone watching this, there's a lot of power in prayer and a power in trying to help someone even when you don't know them. So I would ask anyone listening to this right now just to, say a prayer, make a wish, put some positive energy out there to help this person that you don't know. But and my belief is that every human being's life has value, and we want to do everything we can to save everyone that we can. So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is the standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So where someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to Causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.